Hello, I'm Dr. Emily Chen, a neurologist with over 6 decades of medical practice. Are you finding yourself forgetting names more frequently than before? Does your mental focus seem to drift away when you need it most? Are you concerned about maintaining your cognitive abilities as you age? What if I told you that the solution to these problems might literally be at your fingertips? Today, I'm going to share 3 simple scalp and neck techniques that can significantly improve your brain function by enhancing circulation, stimulating neural pathways, and reducing tension that impairs cognitive performance. These methods have helped hundreds of my patients regain mental clarity and memory function. Let me tell you about Robert, a 72-year-old former university professor who came to me in a state of despair. This brilliant man, who once lectured to hundreds of students, could no longer remember their names. He struggled to focus on reading, something that had defined his entire life. After consulting numerous specialists without finding solutions, he feared he was developing dementia. I taught Robert these 3 specific scalp and neck techniques I'll be sharing with you today. After just 6 weeks of consistent practice, the transformation was remarkable. His memory sharpened, his concentration improved, and his mental energy returned. His family noticed he was more engaged in conversations and even rejoined his beloved book club. I understand if you're skeptical. I was too when I first encountered these concepts decades ago. Initially trained in conventional Western medicine, my perspective changed dramatically during a sabbatical in East Asia in my 40s. There, I observed remarkably sharp-minded elders who practiced daily self-care routines targeting the head and neck. Before we dive into the science and the specifics, comment below where in the world you're watching from. When I returned from my sabbatical, I began researching the neurological basis for these techniques and integrated them into my practice. Over decades, I've documented remarkable improvements in cognitive function among patients who consistently applied these methods. You see, modern lifestyles create 3 key issues affecting brain function. First, restricted cranial blood flow due to prolonged sitting, stress, and poor posture. Our brains require constant, abundant blood flow to function optimally. Second, diminished neural stimulation that accelerates cognitive aging. Like muscles, neural pathways weaken without regular activation. Third, tension accumulation in the neck and base of the skull impairs cerebrospinal fluid circulation, the crucial system that delivers nutrients and removes waste from your brain. These factors collectively contribute to what many of my patients describe as brain fog, memory lapses, and reduced cognitive function, exactly what Robert was experiencing. When Robert first visited me, he described his symptoms with tears in his eyes. "Dr. Chen, it feels like I'm losing myself piece by piece. Yesterday, I couldn't remember my granddaughter's birthday. I've celebrated it for 12 years. After examining him and finding no indications of serious neurological disease, I explained my approach. Initially, he was doubtful. Massage my scalp and neck to improve my memory? That sounds too simple to work, he said. I asked him, Robert, have you ever noticed how a gentle neck stretch or head massage can instantly clear your thinking after hours at a desk? He nodded in recognition. What we're going to do, I explained, is apply specific, targeted techniques that stimulate key neural pathways and enhance blood flow to your brain in a systematic way. I showed him how the scalp and neck are not just protective coverings for the brain, but dynamic interfaces with thousands of nerve endings, blood vessels, and lymphatic channels that directly impact brain function when properly stimulated. What convinced Robert to try my approach was my own story. At 92 years old, I still see patients, give lectures, and recently published my 4th book. I've been practicing these techniques daily for over 50 years. "What do I have to lose?" he finally said. "Let me share the first technique, the cranial circulation boost. This simple scalp massage stimulates blood flow to key areas of your brain. Your brain represents only 2% of your body weight, but requires 20% of your blood supply to function properly. Even minor reductions in circulation can impair cognitive function. Start by placing your fingertips at your temples. Apply gentle pressure and move in small circular motions for 30 seconds. Next, move to the crown of your head and repeat. Then to the base of your skull. Work methodically across 10 specific points on your scalp, spending about 2 minutes total. For Robert, this technique alone produced noticeable improvements in mental clarity within days. "It's like turning up the dimmer switch on a light," he told me during our follow-up. "My thoughts are brighter, more accessible." The second technique is vagus nerve stimulation. The vagus nerve is your body's major communication pathway between brain and body. When stimulated properly, it reduces inflammation and improves brain function. Place your fingers gently on either side of your neck, just below your jaw. Slowly rotate your head to the right while applying very light pressure, then to the left. Repeat 5 times. This gentle movement stimulates vagus nerve branches that run through your neck. Maria, a 65-year-old artist who had lost her creative spark, found this technique particularly effective. After 2 weeks, she said, ideas started flowing again. The creative block I'd struggled with for months simply dissolved. These techniques work because they address the fundamental physiological needs of your brain: proper circulation, neural stimulation, and waste removal. They're not magical solutions, but rather strategic ways to optimize your brain's natural functions. The third technique is what I call the cerebrospinal flush. This specialized movement optimizes the flow of cerebrospinal fluid, the vital liquid that bathes your brain and spinal cord, removing metabolic waste products and delivering nutrients. Sit comfortably and gently tilt your head back, placing your fingertips at the base of your skull in the slight depression there. Apply very gentle pressure while slowly tilting your head forward until your chin touches your chest. Hold for 5 seconds, then return to neutral position. Repeat this movement 5 times. This technique is particularly powerful because cerebrospinal fluid stagnation is rarely addressed in conventional medicine, yet it's crucial for brain health. Think of it as a gentle internal cleansing for your brain. James, a 58-year-old executive, came to me complaining of persistent brain fog that was affecting his decision-making. After incorporating these techniques, especially the cerebrospinal flush, into his daily routine, he reported, "It's like someone cleared the cobwebs from my mind. My strategic thinking has returned." Now, these techniques must be practiced with certain precautions. Avoid them if you have recent head or neck injuries, cervical spine issues, or have had recent brain surgery. While gentle, they're stimulating key physiological systems. And remember, these support brain health, but complement regular medical care, not replace it. The true power comes from consistency. Practice all 3 techniques daily, ideally in the morning, to set your brain up for optimal function throughout the day, and again in the evening to clear accumulated tension. Most patients report noticeable improvements within 2 to 3 weeks of consistent practice. Sophia, an 80-year-old grandmother, incorporated these techniques into her daily routine and experienced remarkable results. "I was struggling to learn how to use my new smartphone to video chat with my grandchildren," she told me. "After a month of your brain-boosting techniques, not only could I manage the technology, but I found myself teaching my friends how to use their devices too." What makes these techniques so effective is that they address multiple factors simultaneously: circulation, neural stimulation, and waste removal, creating a synergistic effect greater than any single approach. To enhance the effectiveness of these techniques, I recommend 3 complementary habits. First, proper hydration is essential for optimal brain function. Aim for 8 glasses of water daily, perhaps with a morning cup of ginkgo or rosemary tea, both known for their cognitive benefits. Second, incorporate regular movement throughout your day. Even standing up for 2 minutes every hour significantly improves cerebral blood flow. Third, practice this simple breathing exercise. 3 slow, deep breaths before each brain-boosting technique to maximize oxygen delivery to your brain cells. The results I've seen over my 6 decades of practice have been consistent and remarkable. Patients report improved memory recall, enhanced concentration, greater mental endurance, and reduced brain fog. Many describe feeling reconnected to their mental capabilities. One particularly moving case was Eleanor, a 76-year-old former teacher who had given up her book club and bridge games due to embarrassment over her failing memory. After 8 weeks of consistently applying these techniques, she not only rejoined both activities, but found herself enjoying them more than ever. "I'm not just remembering better, Dr. Chen," she told me with tears in her eyes. "I'm thinking more clearly than I have in years." Let me address 2 common questions. First, how long does it take to see results? While individual responses vary, most people notice subtle improvements within the first 2 weeks and significant changes by week 6. Second, can these techniques help with more serious conditions like dementia? While they're not a cure, they may provide supportive benefits by optimizing the brain's natural functions. Many family members of my patients with early cognitive decline report noticeable improvements in day-to-day function. Remember, cognitive decline isn't inevitable. These simple techniques tap into your brain's remarkable ability to maintain and even improve function at any age. The key is consistency, just 5 to 10 minutes twice daily. I want to conclude by sharing something personal. At 92, I still maintain a sharp mind, lecture regularly, and recently published my 4th book. People often ask what my secret is. While genetics play a role, I firmly believe these daily techniques have preserved my cognitive function. I've practiced them faithfully for over 5 decades. Start with just 5 minutes each morning. Feel the difference after 3 weeks. Then decide if it's worth continuing. What do you have to lose but brain fog and forgetfulness? What might you gain? Mental clarity, enhanced memory, and the confidence that comes with maintaining your cognitive abilities. The human brain is remarkably resilient and adaptable at any age. By incorporating these simple scalp and neck techniques into your daily routine, you're not just addressing symptoms, you're optimizing your brain's fundamental physiological processes. Remember Robert, the professor who feared he was losing himself? Last month, he sent me a handwritten letter. "Dr. Chen, I've just finished teaching a summer course, my first in 5 years. My students commented on my sharp memory for names and concepts. I feel like myself again. Thank you for giving me back my mind. I believe you can experience similar results. Try these techniques starting today, and please share your progress in the comments. If you know someone struggling with memory issues or cognitive concerns, share this video. You might be offering them a life-changing gift. This is Dr. Emily Chen, wishing you vibrant brain health and renewed mental clarity. Until next time, when I'll share my 3 top exercises for spinal longevity.